Are you a nursing student or a nursing grad using artificial intelligence to study? Well, today we have a fascinating topic to discuss: the comparison between Claude and ChatGPT and why nursing students should exercise caution when relying solely on AI for their answers. Let's put this to the test. I have this question from Kaplan. A client had a gastric bypass procedure 4 hours ago. Vital signs are blood pressure 92 over 68, pulse is 112 per minute, and respiratory rate is 22 per minute. Pulse is too high, pulse should be 60 to 100, respiratory rate should be 12 to 20, blood pressure is too low. So we're thinking, maybe this patient is septic. Anyway, which prescription does the nurse question? Number 1, 0.9% sodium chloride infusion at 150 mL per hour. Number 2, epinephrine 1 milligram IV push. Number 3, monitor urinary output hourly for 24 hours. Number 4, infusion of 50 mL of 25% albumin. Now the question says, which prescription does the nurse question? Meaning we're looking for a wrong answer, incorrect answer. So the correct answer here should be epinephrine 1 milligram IV push. So I got curious. I said to myself, let me see, how about if I copy and paste this to the AI and see if they can answer this question. So I use ChatGPT and Claude. So first I copied and pasted this to Claude, and here's the result. So this is Claude. When I pasted this to Claude, Claude said the correct answer is 4. Infusion of 50 mL of 25% albumin. The rationale: after a gastric bypass procedure, administering albumin is not appropriate intervention for hypotension and tachycardia. Albumin will not help improve hemodynamic parameters in this situation. So I got confused because my answer, number 2, epinephrine 1 milligram IV push, is supposed to be the answer according to Kaplan. So I asked Claude. I said, Kaplan's answer is number 2. Why? So then Claude corrected itself and says, you're right. Upon further review, the correct answer is 2. But anyway, so Claude screwed up. Claude chose the wrong answer here. So now let's go to ChatGPT, shall we? So here's ChatGPT. This is even 3.5. It's not even 4. So it says, here's the pasted question and the answer choices. And now ChatGPT says, so the client underwent a gastric bypass procedure, which is a major surgical intervention that can have significant effects on the body's physiology, including fluid and electrolyte balance. Given the vital signs reported, it appears that the client may be experiencing some hemodynamic instability. This is characterized by a low blood pressure, hypotension, and an elevated heart rate, tachycardia. So now, ChatGPT reviewed, and that's the rationale. I'm not going to read it because it's too long. I'm only going to read the summary, the answer. In summary, the nurse should question the prescription for epinephrine 1 milligram IV push and 50 mL of 25% albumin. So ChatGPT chose epinephrine 1 milligram, which is the second, number 2 answer, which was my answer and Kaplan's answer. So now I'm thinking many people are claiming that Claude is better than ChatGPT, but now, and I've been using Claude now because it's free, and so I don't have to pay $20 for the version 4 of ChatGPT. But now, after seeing this, as a nursing grad studying for the NCLEX, I wouldn't trust Claude now. Anyway, so that's my comparison. So you decide. As a student, as a nursing student, especially nursing students, I wouldn't trust Claude or ChatGPT even for choosing my answers. In this experiment, it shows that ChatGPT is a little bit better than Claude. Okay, that's it. That's all, folks.